And now, ladies and gentlemen, it's our turn to listen to this young and dynamic policy maker who has transformed the healthcare insurance process in Maharashtra by initiating series of initiatives. Well, he's known for his no-nonsense attitude and also promoting transparency and honesty in his working environment. Well, ladies and gentlemen, he's currently posted as the CEO of Rajiv Gandhi Jeevandai Arogya Yojana Society and is managing the largest state-level health scheme with 2.23 crore beneficiary families. He has now successfully integrated the state scheme Mahatma Jyotiba Phule Jan Arogya Yojana with the center's flagship healthcare scheme, which we call as Ayushman Bharat. Yes, ladies and gentlemen, we look forward to his valuable insights today to enlighten us all with his experience of effectively managing the largest state-level healthcare scheme in the country. And it's time, and it's my privilege and honor to welcome on stage none other than Dr. Sudhakar Shinde, CEO, Mahatma Jyotiba Phule Jan Arogya Yojana Ayushman Bharat, to kindly give his perspective and vision on National Health Protection Scheme, challenges of ensuring quality healthcare at affordable costs.
I'm very thankful to Sri Satya Brahma and his team to organize such an event which has very varied perspectives, and everybody here is talking about India being a superpower. India being superpower in terms of wealth, in terms of technology. And my friends, when we are talking about India being a superpower, a very important aspect that we must not forget is the health of the Indian citizens, which will be an essential component to make India a superpower. When we analyze the data of healthcare expenditure in India, we realize that in India, every year 5% of Indians are pushed below poverty line because of catastrophic out-of-pocket cash expenditure that they have to do on the healthcare. Looking at these numbers, it will be the most important thing to do to ensure these poor people, needy people who are at the bottom side of the population pyramid, and to provide them a social security network which will prevent them from spending such catastrophic expenditures. Friends, if these people are not able to meet with these expenditures, either they can't avail the standard healthcare that they are supposed to. Second thing, if they at all able to access to the healthcare, they will have to spend their savings, they'll have to borrow money from someone, they'll have to sell their some assets, or they'll have to compromise on education of their next generation, or some other value proposition they were going to make out of business or something. So, looking at this scenario, Honorable Prime Minister, when we unfolded national health policy and national health mission, in 2017, the government of India has targeted universal health care. And to meet that universal health care, government has come up with a very ambitious scheme called Ayushman Bharat. On 23rd of September 2018, Honorable Prime Minister launched the scheme from Ranchi, Jharkhand, and along with that, many other states, including state government of Maharashtra, also integrated this scheme with its own scheme, which is existing since 2012, called Mahatma Jyotiba Phule Jan Arogya Yojana. Friends, let us talk about Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The context of the scheme is that around 90% of persons are informally employed in our country. Like either others are employed either with the government, semi-government, or some organized sector, but 90% are employed in informal sector. High out-of-pocket expenditure for healthcare services is one of the main contributors to poverty that I have already told you that around 5% of population is pushed below poverty line because of this kind of expenditures. We appreciate that government is spending less, like 1.2% on GDP, and it is to be increased to 2.5% until 2025. The private healthcare providers are very poorly regulated, that we can see that there is no capping, there is no standardization of healthcare packages in private healthcare. Somebody can do same kind of surgery in X amount of rupees, and some very high-end hospital does same kind of surgery in 5x or sometimes even 10x kind of cost. Private healthcare cater to almost 2/3 of population. So government healthcare sector has some kind of infrastructure deficit at this point of time. Government is doing all the efforts to bring that infrastructure, but till such time, government has no other option but to leverage this private healthcare infrastructure, and to leverage that private healthcare infrastructure, government has entered into public-private partnership, and that public-private partnership is through Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Such schemes were earlier existing in India. This is not the first of its kind, but the magnitude of the scheme, the depth of the scheme, and the cost that is involved in the scheme is uncomparable with the earlier schemes. So the political will to give the priority to the health sector is very important, to put such tens of thousands of crore rupees for such health insurance scheme that this government has been able to do. Government took a very comprehensive view of healthcare sector. Existing health insurance scheme called, there was a RSBY, that scheme was stopped, and that this new scheme was introduced, because that scheme was it had very thin coverage, around 30,000 rupees per family per year. So now we have scaled it up. More than 25 states in our country, including states like Maharashtra, has their own health insurance scheme, and so there was need to integrate these schemes and to bring a national level scheme so that we can have a very synergistic kind of health insurance schemes. Ayushman Bharat scheme has two components. I was talking about health insurance scheme in terms of Pradhan Mantri Jan Arogya Yojana, which is a health insurance scheme. There is another big component which is not much discussed nowadays, but it has to be emphasized of Ayushman Bharat is, government is when providing health insurance scheme for secondary and tertiary health care in terms of surgeries, operations, some interventional procedures. Government has also focused on primary health care, upgradation of primary health care sector through another component of Ayushman Bharat, which is kind of building 150,000 health and wellness centers across the country. In India, we have sub-centers after the level of primary health center, and government is upgrading those centers. At some places we are creating new centers, and they will be called as health and wellness center. So putting these two components together, we will have a very comprehensive, we will have a very holistic healthcare model. Primary healthcare will be provided through government's own infrastructure, and secondary and tertiary care will be provided through public-private partnership through public-funded health insurance schemes. Pradhan Mantri Jan Arogya Yojana provides cover of 5 lakh rupees per family per year. Friends, when I say this cover is of 5 lakh rupees, in market parlance, this cover is not less than 12 lakh rupees. I also have my own health insurance policy from a private healthcare provider, and my family has cover of 8 lakh rupees floater basis. That cover of 8 lakh rupees can cover 2 or 3 big catastrophic surgeries like angioplasties or bypass surgeries, and my 8 lakh cover will be wiped off. Because in my health insurance scheme, cost of a bypass surgery is around 3.5 lakh rupees. But when we, at the government level, when we command the volumes, we have been able to negotiate with the hospitals and healthcare providers to bring down that package from 3.5 lakh rupees to around 1.5 lakh rupees. So when I say the health cover of 5 lakh rupees, this health cover for common parlance is somewhere around 12 lakh rupees. And this health cover is for all the members of a family. It is on a floater basis. There is no cap on family sizes. Somewhere family sizes are 10, 12, and the entire family group member is covered under the scheme. Government of India through this scheme is providing insurance to around 500 million poor and vulnerable population. For that matter, to have such kind of numbers covered under public funded health insurance scheme. So this is world's biggest health insurance scheme. If you compare this scheme with United States government's health insurance scheme, the population of United States is somewhere around 35 crore. Here, in this health insurance scheme, we are covering more than 50 crore population of this country. So that is around 40% of the country's total population. The core features of the scheme: 5 lakh rupees per family per year. In throughout the country, we have 10.74 crore poor and vulnerable families eligible. Out of these 10.74 crore families, Maharashtra has 84 lakh families. State have flexibility to decide their mode of implementation. Mode of implementation means either you go through insurance company, pay them premium, and insurance company takes care of the claims of the hospitals, or trust mode, where the government directly pays to the hospital on the actual basis of the claims. Benefits are portable across the country. Like our state health insurance schemes were not really portable because we had our own limitations, but this scheme has a national portability that a beneficiary from Maharashtra can go and take its treatment at AIIMS, and beneficiary from Northeast India can come down to Mumbai and take his treatment for cancer in Tata Memorial Hospital in Mumbai. The scheme is entitlement based. The entitlement is already decided. The ease of access and transparency in implementation. There is no formal enrollment process. The entitlement is based on the census that was conducted in 2011. So the data has already been worked upon, and there are certain criteria that have been applied to census data, and those vulnerable groups have been picked up from census, and those families have been made beneficiaries of the scheme. Very extensive IEC activities for the eligible families to make them aware that they have been covered by the government and they need not spend money from their pocket has been done. Very transparent and seamless process. The cost control through fixing packages that I have already explained, like in normal health insurance scheme, or for that matter, the rack rate of hospital for bypass surgery is 3 lakh, 3.5 lakh, and here my negotiated rate is around 1.5 lakh rupees. We have a robust fraud control, robust audit mechanism, grievance redressal mechanism. I have joined this scheme around a year back, and in a year, I have personally visited the hospital, found certain frauds, and around 100 hospitals have been de-empaneled out of the schemes, and we have recovered certain money from them. So this is a very transparent, we have very robust grievance redressal mechanism. The national portability that I have already explained. When we have such a huge scheme catering to 50 crore people, the access of people to the information becomes an issue. So Government of India and Government of Maharashtra has set up 24/7 helpline, which has more than 400 seats of call center which works 24/7. So anybody who needs information on this scheme, whether that person is the beneficiary of the scheme or not, how to get benefits of the scheme, which is the nearest hospital where I can go and do my surgery, what are the formalities that I need to complete, everything will be explained to you through this call center. As I told you, the rural beneficiaries, urban beneficiaries, the earlier schemes left out beneficiaries, total beneficiaries are 10.74 crore families. So in India, the family size is somewhere around 4.8, 4.9. So I'm talking about 50 crore beneficiaries to be covered under the scheme. Who are the beneficiaries that are covered from the census data? When we look at the census data, the data has various parameters that we capture when we do census. So we have captured certain deprivation criteria. If a person, when the census was done, has only one room with a kacha house, kacha wall and kacha roof, that family is part of our scheme. The other criteria is no adult member between age 16 to 59, they are part of the scheme. Female-headed households with no adult member between 16 to 59. Disabled member and no able-bodied adult member in the house. The whole scheduled caste and scheduled tribe households who are residing in rural area. Landless households deriving major part of their income from manual casual labor. There are certain groups which are automatically included, are households without shelter, destitute, living on alms, manual scavenger families, primitive tribal groups, legally released bonded laborers. These are the rural criteria. Now let's go to the urban criteria. In urban area, the criteria is not on socio-economic or caste based. In urban area, it is more on occupation based. So here we have urban population at the time up to, please note that all these criteria are from 2011 census. So whomsoever was recorded within these categories, they are part of the scheme. The rag pickers, beggars, domestic workers, street vendor, cobbler, hawker, other service provider working on street, construction worker, plumber, mason, labor, painter, welder, security guard, coolie, and another head load worker, sweeper, sanitation worker, mali, home-based worker, artisans, handicraft workers, tailors, transport worker, driver. You name an occupation which is working in an unorganized sector, they are part of this scheme. Why I am emphasizing on these groups? Because we all have some kind of beneficiaries related to our life, like someone must be maid at your home, someone must be your driver, someone must be mali, someone must be working in a small shop next door to your building where there are just 2-3 people working there and they are not covered by other employee state insurance scheme or so. So please direct them to get in touch with the government through our helpline and they can avail these benefits. Like states have their own schemes. I am proud to say that Maharashtra government's its own health insurance scheme, and its population, if we compare, Maharashtra has the total households as per SECC data 2.29 crore. Maybe these households have been increased now because of splitting of the families or so. And my scheme, the state's own health insurance scheme, which is there for last 6 years, is Mahatma Jyotiba Phule Arogya Yojana. It covers 99.3% population of the state. So look at the expanse of the state health insurance. That's why I'm saying that Maharashtra health insurance scheme is the biggest state level health insurance scheme in the country and per se in the world. Expected outcomes, financial protection for the population, merging of small risk pools to form a large pool so that we have economies of scale and we can command the lower premium with the government or the hospitals. We can enforce the standard of quality, improved service delivery at public hospitals. As we have certain public hospitals in our scheme, we pay them for their surgeries that they do for our beneficiaries, and we ensure that the surgeries are done at par with the standards that are established in our scheme. Improved access to healthcare services to Tier 2 and Tier 3 cities. As I rightly said, as I earlier mentioned, that in cities it is very common to get good hospitals, but in Tier 2 and Tier 3 cities, government infrastructure is also not able to keep pace with the requirements. So this is the time where we have been collaborating with the private healthcare sector. Improved access to healthcare services, extra health job creations and stimulation to rural economy. When I say my scheme is implemented in a particular hospital, in that hospital we have 2-3 Arogya Mitras working round the clock. We have data entry operators who are entering that data in the system. So when we empanel one hospital, around 5 to 10 jobs are created because of the scheme. So it is a thrust to the economy. So this is the implementation so far. Barring only 2-3 states, the scheme has been implemented so far. If we look at the performance of the scheme was launched on 23rd of September. Today I am here on 23rd of August. Not even a year has been completed for the scheme. And we have treated around 40 lakh patients across the country. We have given treatment worth 6,200 crores. And as per market standard, this is not less than 12,000 crores. Total applications where the hospitals want to come and get empaneled our scheme is 90,000. Hospitals want to be empaneled. So far we have been empaneled 16,000 and others are on their way. These are some other statistics. If somebody wants to go in detail, they can get this presentation. What is the cost? Look at this, just a minute to spend on, look at the patterns of illnesses that are getting covered. 28% cost is going to the angioplasties. 12% cost is going to the bypass surgeries. So, out of the 100 rupees that is spent on the scheme, 40 rupees is spent on cardiac illnesses. So, this is an alarm sign for all of us to look at the burden of healthcare in terms of cardiac diseases. In Maharashtra, we have integrated both these schemes, and the performance of integrated scheme for my state is 25 lakh. It is around 5.18 lakh beneficiaries we have treated in last 11 months for my state. The claims worth 985 crore have been given to the hospitals in last 11 months. And another 2-3 months claims are under process. We have applications of 1,200 hospitals. So far we have been able to empanel around 500 hospitals, 492. When we are implementing such a huge scheme, maybe the biggest health insurance scheme in the world, we have certain challenges. We have to look at our data and update our data in terms of beneficiary data accuracy, because this data was recorded in 2011, and now after 6 years there are a lot of changes, that certain families have been expanded, certain family members have been deleted on account of death. There are marriages in family, marriages out of family, so we need to verify the current status and accordingly update our data. Mapping of data with SECC data, that the state scheme is based on ration card, SECC data schemes, and we need to map those schemes so that there is no duplication, so that we are saving on money and not paying the premium twice for a single beneficiary. We have to integrate all states' health insurance schemes on the same platform, so we have to refine our IT systems. We have to do institutional strengthening, fraud control and monitoring, portability of benefits, like still we are facing certain problems in terms of processing the claims from one state to the another state, alignment of supply side of the healthcare. As I say that the country like India, where we are in Mumbai and it is very easy to get somebody operated for bypass surgery in Mumbai, but that is not the case for a hospital in northeastern part of the country. That is not the case for somewhere in Bihar or somewhere in Uttar Pradesh. So we have to do certain portability for those cases, and access of healthcare is still an issue. Thank you all. This is an immense pleasure to present these health insurance schemes to you all. I'm very sure that nobody sitting here is a beneficiary of this scheme, but the people who are working for you, the people whom you come in contact with, maybe the people who are working in your offices, your relatives' offices, as houses and all that, those are the people who are most vulnerable for these healthcare expenditures, and they have our schemes. Especially in Maharashtra, if somebody is not beneficiary of Pradhan Mantri Jan Arogya Yojana, through this SECT data, the state scheme is very simple scheme which covers almost 99% of state's population. This is purely based on ration card. If anybody has yellow and orange ration card, they can go to the hospitals empaneled in our scheme and get their free treatment. And for all queries, they should contact our helpline number 155-388. If you need any more information on this scheme, you can get through this toll-free number. At the cost of repetition, I will repeat the toll-free number again, 155-388. Thank you very much.
Thank you so much, Dr. Sudhakar Shinde. I would request you to kindly stay back, and this is really the need of the hour. As we all know, that everyone has right to education, and so does everyone has right to healthcare at affordable prices, and that's what we are working towards. As we all know, Health is wealth. So thank you so much, Dr. Sudhakar Shinde, for this insightful information on Ayushman Bharat.
I just wanted to tell you one thing. I've known Dr. Sudhakar Shinde for a long time. Not a long time, it's only 1 year back only, but 1 year is a very good period. He's the one who has been transferred multiple times actually. The people at the center, those who actually do, all the ministers and all the political people, how many times have been transferred, if I have to recollect?
That's part of my job.
No, but many people are not transferred because if you are honest and upright, they get transferred, but still he has not given up. And what, did you notice what he told at the end? He's told, this is not for his benefit. He told, remember the toll-free number, remember the toll-free number. This shows his enthusiasm, this shows his commitment, this shows his sincerity, that how he wants to make this initiative to the public actually. I am sure there cannot be so many upright officers like this. I'm really proud that you are with us, and I wish India could have so many big officers like you. Despite having all the challenges, you are doing a fantastic job. I remember Mayangani told me also once that some of the hospitals who are not entertaining this patient, he has state banned them actually. Shut down, hospitals have been shut down. I really compliment you for this, and I'm really proud that you're with us, and our wavelength really matches actually. Thank you very much. This is a small token of appreciation.
Thank you so much, Mr. Satya Brahma, for felicitating our very own Dr. Sudhakar Shinde. Thank you so much. It was really a proud moment to have you here, sir. And yes, we really need someone as strong and as worthy as you to put this scheme, Ayushman Bharat, forth and make it implemented and help people around. And now, ladies and gentlemen, it's time to call upon the next speaker. Well, she truly embodies women empowerment. What should I say about her? She is a very influential lady and a very influential personality when it comes to luxury industry of India. Ladies and gentlemen, she has her venture called Soho Wine Club and also Sonal Holland Wine Academy, India's most respected institution offering certified WSET wine courses. Well, currently she is a wine buyer and consultant for luxury food retail chain Food Hall, and is also a wine consultant for restaurant group Gourmet Investments. Adjudged as the Wine Personality of the Year, recently Ms. Sonal is regularly featured as one of the most powerful women and is one of the most influential personality in India's luxury industry. So ladies and gentlemen, without much ado, it's time to welcome the very beautiful, the very gorgeous, none other than Ms. Sonal Holland, founder Sonal Holland Wine Academy and Soho Wine Club, to kindly join me on the stage and share her insights and view about understanding the business of wine. What will drive India's wine and food tourism to the next level? Thank you so much, ma'am.
Satya, thank you so much for this great opportunity, and I'm very, very excited. But let me start. Ladies and gentlemen, it is a privilege to be standing here in the midst of India's most illustrious leaders, captains of the industry, political dignitaries, and change makers. Today's agenda is to discuss ideas on how we can build a $5 trillion economy by 2025, and I will speak to that objective through a wine-tinted lens, with the hope that I can inform, enthuse, and inspire you. I am Sonal Holland, India's first master of wine. 3 years ago, I became a part of an elite group of wine professionals, earning the most prestigious title in the world of wines, awarded by the Institute of Masters of Wine in the UK. The examination to earn the title are considered to be among the toughest on the planet, and stats have it that more people have been into space than have become masters of wine. In fact, currently, there are 382 masters of wine across 30 countries, of which only 131 are women. As India's only master of wine, I stand here today as an ambassador of its industry and a custodian of its culture, with a strong commitment to make meaningful contributions to this industry and ensure that India has a voice at wine tables around the world. India is an enigmatic land where myth and reality collide. On the one hand, we're a land of opportunity, a country of over 1 billion people, with nearly 500 million above the drinking age, boasting of a young demographic that is open to experiment with global and homegrown beverages. On the other hand, India's alcobev industry is shackled by cripplingly high taxes and, dare I say, a dense regulatory system of antiquated laws. In this paradox lies a significant future opportunity for the wine industry. The increased availability of locally produced and imported wine over the past decade has spawned significant consumer interest in wine. Wine currently is India's fastest growing beverage and has recorded a double-digit growth consistently over the past 10 years. This has been aided by rapid urbanization, broader exposure to Western lifestyles, and increased consumer spending. Findings on India Wine Insider, a consumer research report that I launched in collaboration with Wine Intelligence, which is a global leader in wine consumer surveys, shows that Indian consumers today view wine as classy, healthy, and a socially acceptable beverage. Interestingly, there are an equal number of women purchasing and drinking wine as men. Women view wine as sophisticated, a socially more acceptable, and a respectable drink to be seen drinking with family members. And wine occupies a definitive place in a young millennial's drinking repertoire. They are keen to try different styles of wines and experience the wine lifestyle. So what better way to experience the wine lifestyle, 360 degrees, than to travel to a wine-producing region, learn about different types of wines, enjoy some good food, indulge in the hospitality, explore the culture and the scenic offerings of that place. Wine tourism, my friends, today is one of the most coveted travel experiences among travelers globally. According to the World Travel and Tourism Council's 2018 report, travel and tourism accounts for 10.4% of the global GDP and provides 313 million jobs. This translates to a whopping $8.3 million to the world economy. At the first global conference on world tourism in 2016, the UNWTO, which stands for the United Nations World Tourism Organization, reported that wine tourism is a growing segment which offers wineries considerable potential to take a leading role in showcasing excellence in regional tourism. Over the last decade, wine tourism has become increasingly important within the niche of gastronomy tourism and a pillar in many destinations' diversification strategies. We may have at some point heard of or even experienced wine tourism at France or Italy, but wine tourism has taken off pretty much all over the world. Argentina, Germany, Spain, Austria, Georgia even, wine tourism experiences draw tourists from far and wide. Wine tourism can profoundly impact states' economies and indirectly shape their demographics and the culture. The wine industry has ripple effects that affect manufacturing, tourism, small businesses, farmers' socio-economic welfare, city infrastructure, and job creation. Several wine-producing countries have endorsed this approach and have embedded it in their current government strategies, which features the pairing of tourism with agriculture, both key industries in the economic, social, and cultural development of a country. Here are some examples around the world. Consider California, which is America's #1 wine producer, making 81% of all US wines. The economic impact of Californian wine industry on the US economy is $114 billion annually. California pays $15.2 billion in taxes annually and provides 786,000 jobs to Americans. Of this $114 billion revenue, $7.2 billion is generated through wine tourism alone, with 24 million tourists who are mainly domestic visitors visiting California's 4,800 registered wineries. Mind-boggling numbers. And the Californian industry is not even that old. Its real tryst with destiny started in 1976, when its wines were rated higher than some of the French counterparts at a famous blind wine tasting. Speaking of French wines, around 10 million tourists, wine tourists, visit the French wine regions, and they generate a revenue of 5.2 billion euros annually, with the majority visiting Bordeaux and Champagne because these regions represent the prestige in the French wine world. New world country New Zealand, with a wine industry that came into prominence only 25 years ago, today boasts of $3.8 billion spent annually, with 712,000 international tourists, and have seen a 35% growth in their wine tourism since 2015. Even a small country like Armenia, does anyone know where it is? Just the creation of a wine route coupled with a creative marketing campaign has helped draw worldwide attention to Armenia's ancient wine culture and increases visits to wineries by 53% and tourism revenue by 10% in the last 3 years. So coming to the point, where is India? The contemporary Indian wine industry is still at a nascent stage. It is less than 3 decades old. We have over 26 operational wineries across predominantly 2 states in India. And whilst Karnataka is an important production hub, nearly 80% of the production takes place in Maharashtra, with Nashik widely regarded as the wine capital of the country. The foresight of Rajiv Samant, founder of Sula, who's India's largest wine producer with a lion's share of the market, led to the development of Nashik and has put India on the global wine map. Sula has launched impressive tourism initiatives and boasts of over 350,000 enthusiasts visiting their wineries in 2018. This is probably the largest number of visitors at any single winery in the world. Other producers, including Grover Zampa and Fratelli, continue to make significant investments in bolstering tourism at their locations in Igatpuri and Akluj, respectively. But these interspersed winery efforts need cohesion, and they need amplification at a regional level in order to make an impact at a national and international level. Nashik and other places in India as wine tourism destinations have an opportunity to attract domestic and international visitors by offering distinctive experiences. These can be involving discovery of our rich heritage, culture, folklore, history, character of the region through exploration and human interaction. These experiences can range from tasting the region's traditional foods, being guided along century-old rivers, visiting mystical temples, participating in the unchanged traditions of rural life, and enjoying high-quality musical and cultural events. Not to mention tasting some amazing wines too. To enable this, what is required first is the acknowledgement of wine as an agricultural product rather than a product of alcohol. This acts as a starting point to further pave the way for implementing smart regulation approaches that clears away burdensome, unnecessary regulation for the wine industry and small and medium-scale enterprises associated with it. What is pertinent to note, here's some interesting facts, is small and medium-scale enterprises, including wineries in India, tend to be more labor-intensive than machine-intensive. This in turn helps create jobs, something we really care about at the moment. Producers in India are moving towards sustainable farming practices, including water recycling, water conservation, through drip irrigation techniques and development of solar panels for energy conservation. They tend to employ more women than men for their vineyard operations, which is again very important towards rural women empowerment, something that Ms. Shweta spoke about earlier. Some are also helping uplift the nearby villages by imparting farmer trainings, education to the children, and partaking welfare activities. Easing regulations with investments from the private sector and support from key donors will enable the wine industry in India to be poised for exponential growth in inbound tourism, focused on the rural progress and job growth. UN WTO studies showed that for every 30 tourists, 1 new job is created in the tourism industry. And given our magnanimous and personalized level of Indian hospitality, I'm sure that ratio is most likely lesser. In several international markets, wine is at the heart of social customs and eating traditions. It is synonymous with food and conviviality. And in many ways, it represents civilized drinking through moderation. As a cultural representative of the wine community at large, I too advocate consumption and enjoyment of wine responsibly. Wine here too is perceived as a sophisticated beverage, meant to be sipped and savored rather than guzzled. With wine being positioned as an experiential and aspirational beverage, and as India's ambassador for wine, I'm attempting to change perceptions about this drink, dispel myths, while stimulating conversations around it and instilling enthusiasm in a nascent market through education. At Sonal Holland Wine Academy, a wine and spirits education institute, which we founded 10 years ago, we have before us a great opportunity to collaborate with the government in the field of creating awareness about the drink. A nationwide program to train stakeholders at the retail and institutional level on the aspects of responsible alcohol consumption will help put health and safety first and create new standards for India's F&B and wine retail industry. And it would indeed be my privilege to be of service to the nation and the industry. Undoubtedly, the Indian wine making industry can be the poster boy for the Make in India campaign. We need to inculcate among Indians love and pride for the national product. In praise of Indian wines, they are now finding themselves listed at top Michelin-starred restaurants across London, New York, Paris. They're also winning awards, both internationally at international wine competitions as well as at India Wine Awards. Indian wines were even poured for dignitaries at Davos. I could go on, but I will conclude by drawing your attention to Honorable Prime Minister Shri Narendra Modiji's recent Independence Day speech, where he urged Indians to turn towards domestic tourism to help boost tourism revenue and attract foreigners. Modiji said that he would like to see Indian tourism figures double over the next 5 years, and he urged Indians to visit at least 15 tourist destinations in India by 2022. I say that we can achieve this by making wine tourism an integral part of our national tourism and rural development policies. Wine tourism can be a tool for rural development, with local communities engaging in and benefiting from the entire tourism value chain. I totally believe that the wine industry can grow from the current 500 crore industry that it is to a 5,000 crore industry by 2025 or even earlier, plus create hundreds of thousands of jobs along the way for rural people. When you're trying to build a $5 trillion economy, every drop in the ocean counts, and that's way more than more than a drop. I, on behalf of my fellow colleagues who work for the Indian wine industry, remain positive and excited about the work we have ahead of us, and we look forward to your support in making India and its wine regions preeminent tourism destinations for Indians and foreigners alike. Thank you for being such an attentive audience and for leading India into a bright and progressive future.
Thank you so much, Mr. Sonal Holland, for this beautiful vision and throwing so much of light and giving us so much of insight on how and what will drive India and India's wine and food tourism to the next level. It was quite an eye-opener when you call the wineries vis-a-vis agro-economy. Thank you so much. And may I request Dr. Satyabhama?
Yes, we'll do that. In fact, the reason why here I wanted to speak something, so everybody thinks that we are discussing politics, we are discussing economy, we are discussing social, cultural, but here we're discussing wine. This is also an integral part of the India actually. But one thing I wanted to ask you, since winemaking in India is still in infancy, and there are a lot of, either a misconception or a general perception about the wine actually. While saying that, I'm definitely not comparing wine with other liquors, but how do you plan to take wine and attract global attention to India? If you could be very brief, I'll appreciate it.
So I'll just answer that. I mean, I'm loud enough, right?
Yes.
But, internationally, there's a lot of interest in the Indian market for the wine business. Everybody, if we were to just relax the laws a little bit and regulations, then we would see enormous interest coming from international markets. But also what's very important is I recently looked over some statistics. So there's an organization called OIB, Organization of International Wines and Wines, which actually shows that India is number 3 in the world for table grape growing production. So we're pretty high up there as far as making table grapes is concerned, and actually that's why we actually even have a wine industry, because historically we've had a great table grape growing and we continue to, and that's how some of it actually translated into the wine industry. But also to throw, India is a member of the OIV. There are 46 member states who are members of OIV, and OIV is essentially involved in helping raise standards of production, marketing in certain markets, and helping markets align with global standards. There's also tremendous interest around flying winemakers around the world who'd be very happy to come here and do a lot of knowledge sharing and so on. So I think if we were to sort of help relax laws a little bit and saw wine as an agricultural product,
just
capable of doing that.
India's pioneer in the wine, and you're also the master of wine actually. Any guess from the audience, how many will be taking wine actually?
I would like to believe all, yeah.
Is it?
Yeah.
Any guesses? How many of?
I can definitely vouch for the ladies.
Yes.
Yes, I mean, so many hands are
But
coming up.
increasingly also men, because like I said, wine is also being consumed for a lot of health reasons. I'm not saying that's true of it if you drink it in copious amounts, but certainly in certain balanced proportions, yes, certainly it can lend, because ultimately the raw material that it's made from, which is grapes, it's a natural product. It just goes through a natural fermentation, and what's inherently in the raw material remains in the wine. It's not a distilled product or a product that's made through any artificial means. So yeah, in certain small amounts, you can derive.
Okay, give her a huge round of applause. That was indeed an excellent proposal.
Thank you so much once again, Ms. Sonal Holland. And may I request Mr. Satyabrahma to kindly felicitate Ms. Sonal Holland, please. A huge round of applause. One more time, ladies and gentlemen.
Please come. Please hold it. Pleasure being here. Thank you.